let people filter in, but maybe we can just go ahead and get started. So thank you everyone for joining us. I'm part of the team at Origin, and we also have Rosy on for an event on 5 ways to give your vulva and vagina postpartum TLC. And I know like what we so often see at Origin is that the last thing that new moms are thinking about or doing postpartum is prioritizing their bodies and their own recoveries. I feel like so much focus goes on to the baby and taking care of the baby and making sure everything's moving along, but taking care of yourself is so important. And your body will have gone through, a huge change from pregnancy to postpartum. So it's really important that you take the time to heal and heal correctly and start feeling good in your new body. And so we're going to talk through some self-care tips, everything from what happens immediately postpartum to, 6 weeks after, and then even into having sex for the first time. And so as a quick reminder, just some kind of housekeeping, we are recording this session and we will share it out with all attendees afterwards. So if you have to hop off or anything, don't worry about that. You'll get the full recording after the fact. And also a reminder that we are not providing medical advice. So if you have any questions after this, you can reach out to your provider, or you can book a visit with Origin if you need to talk to a physical therapist. We got a bunch of questions in advance, as Lindsay mentioned. So I will pop those into the discussion, but if you have anything that comes up, feel free to put it in the chat or in the Q&A section. And then I guess we'll get started. So I am Allison Grant. I lead the marketing team here at Origin. And just to give you a little background on us, what we do is physical therapy for your pelvic floor and really your whole body. And we're focused on, taking care of women at every stage of life. I think for this audience specifically, we help a lot with strengthening for pregnancy and then really into that postpartum recovery when you might be experiencing painful sex or incontinence or ab separation, and providing kind of care that can be accessible for women. So we are an in-network provider. We have Ashley on the call, who is one of our virtual physical therapists based in Texas, but really trying to provide this kind of care to as many women as possible. And then I'll let Lindsay give a little bit of background on Rosy as well.
Yeah. So I'm Dr. Lindsay Harper. I am an OBGYN also in Texas. I love these Texas events. Thank you.
Me too. And the time zone.
Exactly. Yeah. When I was in private practice as an OBGYN, so many of my patients every day, multiple patients would come to me with questions about sexual health problems. And sadly, even as a women's health expert, I really hadn't been trained to help them. So I went and became a fellow of an organization that all they do is study women's sexual health, became exceedingly passionate about, that 43% of women have a sexual health problem, but there just aren't any resources for us, even as physicians, but more importantly, as women, to get those problems solved. So created Rosy, which is a platform with evidence-based resources to solve sexual health problems for women. So we are really passionate about talking about things in a holistic way, meaning not just could there be, a medical explanation, but also really putting a lot of importance on the mental health side of things, on, physical therapy side of things, and really wanting women to understand their bodies and their challenges as a whole picture and not just as, one diagnosis or one problem. So really excited to be partnering with Origin for events like this, and also for some classes that we created for the Rosy platform that are available to y'all. So there's a pregnancy class, a postpartum class, and those really involve an OBGYN, a pelvic floor physical therapist, Dr. Rollins, and then also a perinatal psychiatrist. So really bringing that holistic approach to women's sexual health alive on the platform. So thank y'all so much for having me. I'd love for y'all to check out all the resources we've created, and excited to dig into this topic for sure.
Yes, likewise. And Lindsay, I know you just introduced yourself, but I will just double down that we are such a big fan of Rosy and the resources that they create. I always say my sister-in-law is an OBGYN in Ohio, and she's always referring her patients to all of the great tools that you guys have built on your site. So we love partnering with you on this. And then I'll introduce Dr. Ashley Rollins, who is our lead physical therapist in Texas, based out of Dallas, and she specializes in all things pelvic floor, from pelvic pain to sexual function, a lot of things that we'll actually touch on today. And she's really the expert on all of this postpartum TLC. So I will hand it over to her to kick things off.
Yeah, well, yes, thank you guys so much for joining us. We are so very excited today to talk more about this topic and give you as much information as we can on the ways to give your vulva and vagina the postpartum TLC it deserves. So bring on the questions. We'll first kind of go through first aid. So what are the first steps you need to take to try and help heal and get back to functioning normally in the postpartum period? We'll talk about postpartum pooping. It is oftentimes a very scary feeling in the postpartum period after just having had a baby. So we'll hopefully kind of go over some tips and tricks to ease that process for you. Also return to exercise, perineal massage, and then how pelvic PT can be really helpful in this process as well. So first aid, what is we are so focused on taking care of the baby in those first, months, and we oftentimes forget about ourselves. But in the immediate aftermath after having a baby, whether it's vaginal or cesarean, there is healing to be had. The inflammatory phase is kind of the first stages of healing. This is really the first 1 to 3 days of the healing process. In this time, there's swelling, there's tenderness, tissues are fragile, oftentimes bleeding, and this phase will really build the foundation for the healing process. So how you heal is very important. I always recommend, first off, keep it simple. Ice the areas of tenderness. So, if it's a vaginal delivery, icing the vulvar tissues. If it's a cesarean, icing the incision site. The ice packs in the hospital or frozen peas, DIY padsicles. There's also awesome postpartum recovery kits, like Freedom Mom has one if you've ever seen those, that have the cooling pads in them as well. And those can be wonderful in just managing swelling in the first couple of days and easing some of that postpartum pain. So that you can use your muscles and return to recovery better. Also, peri-bottle. They are awesome at cleaning these tissues. And in vaginal delivery, if you've had tearing, if you have swelling, if you have an incision, then wiping the tissues can disrupt the wound bed. It can be uncomfortable and painful. And something like a peri-bottle to just help clean the tissues is a wonderful way to help that.
I don't know that everybody knows what a peri-bottle is.
Oh, I'm so sorry.
Yeah.
Great, exactly. So peri-bottle is this squeeze bottle that there's a couple of different designs, but it's a bottle of water. You can fill it with warm water, cool water, whatever feels best for you, and you squeeze the water out on the vaginal tissues. After urinating, after having a bowel movement, or if you just feel like you need to cleanse with, sometimes there's discharge and bleeding and that kind of thing, it can be really wonderful to kind of just squirt onto the vulvar tissues and help cleanse the area without wiping.
It's like a DIY gentle bidet for
it's a DIY, yes. Avoid the bidets because those can turn on full strength.
Those are serious.
Fast.
Yes.
Those are very.
We prefer a gentle stream. Gentle stream.
Exactly. And they can be really helpful in helping clean the area. Also gently compressive underwear. We're not talking like tight compression, but oftentimes something
no
like
Spanx.
yoga pants. Say that again?
No Spanx.
No Spanx.
No Spanx. But something oftentimes like yoga pants can be just almost like a hug around tissues that need a little bit of support. A squatty potty is also something, we'll talk a little bit more about that in the pooping section, but a squatty potty can be helpful in easing some of the postpartum bowel and bladder function. And then get a big pack of pads, that is for certain. You need baby diapers. I'm sure you had many diaper cakes and lots of months worth of diapers for the baby, but for you, it is very important to have some pads to help with some of the discharge and bleeding that happens after delivery and incontinence.
We had a question around like how to heal the stitches and sort of like that immediate postpartum vaginal pain. Is there anything else you'd add in around that, like from a first aid perspective?
Yeah, how about What are you
Yeah,
for?
I was gonna say whenever we were talking about using the peri bottle, like that, it feels so like just nice to have that. And then whenever, and you were talking about not disrupting the stitches with wiping, we always recommend more of like a pat dry. So like take your toilet tissue and just like if this is your vulva, just literally just like touch the toilet tissue to it, and that way you're not kind of rubbing or potentially disrupting.
Right.
And honestly, it's kind of like I may have said this our last webinar, but what I always teach my children is that our bodies are magic, truly. And like it's really magic when it comes to the healing of your vulva and vagina after delivery, because like, you know, whenever we see patients and we're doing, you know, repairs of a tear or whatever, you do truly see them back just a few weeks later, and it's magically truly healed in most cases. So less is really more when it comes to caring for sutures. It's not like, you know, if you get stitches or sutures on your arm and you have to do like bandage changes and applying a bunch of ointments. It's basically just kind of leave it alone, pat dry, making sure you're keeping the area clean with your peri bottle. Obviously, when it is time to poop, you're going to want to wipe away from your incision, right? Because we don't want to get that bacteria in the tear or in the incision. So just some very, you know, straightforward things can really go a long way. And it heals pretty quickly. It's like the vagina is like your mouth. It's a mucous membrane, and that's one of the fastest healing tissues in our body. So it's different than if you were to have an incision on your regular skin that's not, you know, a mucous membrane like your mouth.
Yeah. So speaking of pooping, and I've got some wonderful light on me right now.
Yes.
It is oftentimes a very scary situation, right? We, during pregnancy, you're likely, you know, going to experience a lot of constipation, right? There's anatomical changes. The baby is pushing up on the intestines. Things slow down. You have hormonal influence, iron, the vitamins that you're taking can all affect how you're pooping in pregnancy. And then, you know, you have the baby and it doesn't just magically improve. So in addition to that, you know, there's a whole lot of, you know, the pain medications maybe you've taken in the hospital. If you had an epidural, maybe you ate differently, or, you know, you weren't eating during the hours of labor, or withholding fluids or whatever it might be. Maybe you're dehydrated. Then that can all affect how your bowel and bladder function are occurring in the postpartum period. Constipation is not something, you know, in whether it's a vaginal delivery or a cesarean delivery, it will put pressure on the, you know, in the lower abdomen and the vulvar tissues, and you want to be able to have normal, easy bowel movements. So first, I always recommend trying to minimize excessive strain. That can be accomplished by having a softer stool. So that's where something like talking to your physician about stool softeners might come into play. Hydrating well. If you were having to hold off on fluids during labor and delivery, then drink fluids in the postpartum period. And really try and help to kind of, it will all really try and help to ease that process. The squatty potty, again, is something that you put underneath your feet to elevate your knees, basically so that your knees are above your hips. And that will really help to improve what's called the anorectal angle, so that basically your pelvic floor muscles are lengthened and open in the manner that they should be without a whole lot of effort on your part. And so raising your knees up, if you're in the hospital, likely you don't have a squatty potty, but you can do something like turn the hospital garbage can on its side and put your feet up, or even just raise your heels so that your toes, so that your heels are elevated. And then relax your pelvic floor and push with your abdominals. It's almost like I say it's kind of like blowing out like you're blowing a birthday candle, or maybe what you tried to do in labor and delivery, but you're kind of slowly pushing out a birthday candle and opening up the pelvic floor. And you can also, if you had a tear, support the perineal body with your hand. Cover your hand with some tissue paper and kind of splint at the perineum so that there's not a whole lot of excessive range of motion or strain there, which might be painful for any tearing of the tissues.
And the perineum is just that tissue, like if this is the bottom of the of the vagina, and then this is the anus. The perineum is that tissue right between the two. So that's what she's talking about, just kind of holding your hand there. And that's often where two women will have the most, that's like the most frequent site of tearing from delivery. So that's, you know, kind of the place where you want to give it the most support. So I think that's really good. And of all these, I think the two highlights from my perspective, from a physician's perspective, are definitely to stay hydrated, and hydrate particularly with water. Sometimes women drink a lot of liquids and they're like drinking all the other things besides water. But really, postpartum particularly, all you really want is water, maybe some coffee, but lots and lots of water. And that's not only for constipation, but also obviously if your goal, you know, is to make milk, to lactate, then you really, really have to like aggressively hydrate during that time as well, because so much of that fluid is being diverted into making breast milk as well. And then the second thing is definitely, I mean, I don't know that I can't think of a reason that I would not recommend a stool softener. Like, you can get those over the counter. Oftentimes, you know, it can be like Colace, you can do like a little magnesium supplement. Any of those are available widely over the counter, and I literally cannot think of a reason that you shouldn't take one. So I would, you know, if you're packing a bag for the hospital, you might just want to, you know, and go ahead and get that ready to rock and roll so that you're not behind the 8 ball on that. What we really don't want is for you to be super constipated because you're dehydrated, because you've not had a bunch of fiber, whatever, because of, you know, everything that you've been through. That's harder to like deal with is if you get and narcotics. I forgot about that. That's much harder to deal with if you're become constipated than it is to prevent that constipation. So definitely hydration with water, and then those stool softeners I think are key to that success.
Yeah, we had a question too of like, you know, what if you have a grade 4 tear? Like, what does that mean? And, you know, I think that's you all be the experts, but my understanding is like that's like tearing from your vagina to your anus. So like how can are there tips for pooping or things along those lines if that happens?
Yeah, definitely. Lots.
I was just going to show with the pelvic model all the way through the anal mucosal tissue. So the perineal body, here's the vaginal entrance all the way through. So go ahead, Dr.
Yeah, no, I was just going to say, first of all, to all of y'all who are pregnant, it's very rare. Like, please remain calm. It's not a common thing. And, you know, if it does happen, the most important thing is that it's recognized, right? So that if your doctor, if there is a tear and your birth professional recognizes it and repairs it appropriately, you know, most of the time those heal beautifully. And once again, it's like, how did that work, body? You know, like, how did you do that? But it really does. You definitely want to, you know, see a pelvic floor PT if that happens to you. But the important thing is really just what we've talked about. Like for patients who have what we call a 4th degree or even a 3rd degree, really, we counsel heavily about prevention of constipation. We certainly don't want to get behind the 8 ball in those patients. So there's nothing different that I would tell that patient necessarily than I would tell anybody who we're trying to prevent constipation. And you just want to be very diligent about it from my perspective.
Absolutely. I agree with all of those things.
And fingers crossed for that, just to not be your story. And it likely will not be. That's not.
And it likely will not be. And if it is, then we're here to help.
We got your back.
There's healing and recovery from it, certainly.
Absolutely.
So your pelvic floor and your abdominal exercises in the postpartum period. For the most part, we do want to hold off on exercising in the early postpartum period. The first 6 weeks postpartum, we want to hold off on more of the heavy exercise. You want to prioritize healing and recovery. But kind of gentle functional use of your pelvic floor and your abdominal muscles can really be helpful in improving blood flow, reducing swelling. So I always encourage diaphragmatic breathing. So breathe with your belly, inhaling and letting it expand, and then exhale, engaging your abdominal muscles and pulling in to kind of clear the air. Inhaling, letting things relax, exhaling, letting them engage. This is really going to kind of, like I said, help with blood flow. It's also going to help you kind of reconnect with those abdominal muscles that have been stretched for 9 months, that possibly were cut if there was a cesarean delivery, and same with the pelvic floor. And those muscles may protect and kind of go into freeze mode and not necessarily want to work. So just using your breath to gently encourage them can be really helpful in turning them on. But not pushing yourself too far. So this isn't like buckling down and doing all your Kegels. It's gently using your muscles appropriately, using them functionally. So when you're getting up out of bed, you're turning on and engaging the muscles. When you're pooping, when you're having when you're urinating, you're using those muscles appropriately and kind of getting back reconnected with them. And then after you visit your OB-GYN in the 6-week time period, if they clear you, if healing has gone well and things are, and your recovery is appropriate, then you can start gently easing back into your exercise routine if you had one, or even starting on a new one. I kind of generally like to focus on the pelvic floor and abdominal muscle exercises in the beginning. It always depends on where someone is, but I really like to kind of reconnect with those areas of our bodies, work on stability, and then increase impact on the body in the area.
Yeah, I totally agree. I would say in those first 6 weeks, people always want to know when they can go back to exercising, and some just do it without talking to you about it, which is not a good idea. But I would say, like, what I think, if from my perspective, what we're trying to do during those first 6 weeks or 12 weeks or a year for mom and for baby is really to provide like a supportive and restorative environment. And so for you, if that means, going outside and walking around with a stroller and you're feeling up to it, totally, please do that. Like, that's so good for our mental health. That's so good, for just our physical health, and so many benefits to that. But that's not saying we're not running behind the stroller. I always counsel patients that you're going to be tired way sooner than you think you're going to be. So you want to plan for that. Like if you're making like a big loop around the neighborhood or whatever, you just start out slow and then increase gradually. What really happens in those first few weeks, from a patient perspective, speaking as a mom of 3, is that the pelvic floor just feels really heavy. It's all that inflammation and swelling. And so even though your energy might be up, even though you are very motivated to go and do, after you go and do a little bit, your pelvic floor is heavy and you literally just want to sit down for a minute. You know what I mean? And so it's important to listen to your body. There's no reason to push it. We're not like accomplishing any goals here. We're really providing that restorative environment for ourselves, for our baby, and just doing kind of what feels right in the moment. So I would say, if it's like walking, if it's stretching, if it's some sort of not like, hardcore yoga, but more like stretching yoga, then I think that those things are all appropriate with the goal of like mental health and, just like providing like a happy place for you, but not like with a fitness goal in mind, with a weight loss goal in mind, or any of those things. Those things can come later for sure.
Right. And we just have to remember, okay.
Oh, go ahead.
Oh, I was just going to say, we always have to remember, maybe your muscles feel better, maybe your wounds are healing, but there's still a lot going on in your body physiologically that is still returning to normal. The organs are returning to their normal size and location. Your connective tissue, which doesn't have that contractile function, has been stretched and is still trying to kind of settle back to its pre-pregnancy function and state. So the biggest goal in this period, it's so hard to frame it. Believe me, I understand, because I do think I did run a little before my 6-week checkup, but it's bad. I did not follow any of my advice. It's really hard to follow these rules, but setting the foundation of healing and the building blocks of progress start in those first 6 weeks, for sure.
I was going to say, we're talking about heaviness, and it made me think of, we had a question around, so how do you know in this time period if you have prolapse? And if so, like, are there exercises or things that you can really do to make it better?
Yeah. I mean, I'll let you, Ashley, answer that one.
Sure.
For sure, we probably have the same opinion on the topic.
Well, where I start is to look. It's one of those, like you mentioned, Dr. Harper, there is a lot of heaviness and swelling, kind of just like feeling of pressure in that area, with a prolapse and without.
We actually have a question too. If you want to explain prolapse too, one of the
sure.
One of the attendees asked about that.
Oh, sure. So a pelvic organ prolapse is when one of the pelvic organs can fall down into the vaginal vault or the rectal vault. So that might be, maybe the bladder might drop, The uterus and the cervix might drop down. There could be movement of the rectum into the vaginal mucosal tissues, and you'll get like a bulge or a bulge from the vaginal vault or the rectal vault, wherever it has fallen into, which is really just the tissues kind of holding or supporting that pelvic organ that maybe kind of fell out of place. It can occur for a number of reasons. Most commonly, it's that there's that loss of muscular support. In delivery, oftentimes there can be a tear or a strain in the muscles, or maybe some of the ligaments have torn that help to kind of secure some of the organs in place. And if those are affected, then those organs can drop down into the vagina or into the rectum. And so one way to know is to kind of look at the tissues. So oftentimes, still that isn't a good clue. I mean, if you hold like a hand mirror down at if you're standing and you're looking and you're holding a hand mirror down at the vaginal opening and you're looking, if you see any tissue dropping down maybe from the top or the bottom of the vaginal opening, it might mean that you might have a pelvic organ prolapse. Oftentimes it could still be swelling though, especially in the early postpartum period, or maybe you just never really looked at your vaginal opening before, and maybe it's your urethra that you're looking at or something, which is at just above the vaginal entrance here. So it's always looking at it could be a good indicator. Oftentimes I recommend kind of pushing down when you're looking. If you see tissue kind of growing, that might indicate that growing in size or presence, that might indicate that there's a pelvic organ prolapse. Some common symptoms would be like a feeling of falling out or pressure. Some people describe it like there's like a extra full tampon in your vagina that's kind of like dragging down. Or you might just have leakage, urinary leakage or fecal leakage that would indicate that maybe there's a pelvic organ prolapse.
Yeah.
So,
and I would say we don't need to be evaluating that probably before 6 weeks as well, just because whenever you watch a birth happening, like the cervix is right there, like everything comes down into the vagina because there's no room otherwise, like it has to. And so that's part of that 6-week healing process is the, uterus kind of going back into its place, vaginal walls, retracting back. And so I would say if you're going to take a look, then just wait until after that visit. Or if you're concerned about it, you can talk to your OBGYN about it at that 6-week visit if you're feeling that persistent heaviness or fullness in the vagina, because it is normal at the beginning, but it should get better and better pretty quickly. So if that's not the case, then that's something you can definitely bring up.
Absolutely. And so then perineal massage, maybe you're pretty familiar with it in the labor prep, but it can be really good for postpartum as well. 85% of women will have some amount of tearing with a vaginal delivery, to some degree. Maybe it's just a little bit into the skin, or maybe it's all the way to that 4th degree. But the large majority of women that have a vaginal delivery will have some tearing. So that same perineal scar massage can be really helpful. It helps to decrease sensitivity, improve the flexibility of the scar, and also ease any fears that you may have related to to vulvar or vaginal touch with return to sexual activity. Because maybe you don't know what it's going to feel like, and you're a little concerned, like, is it going to hurt? Is it going to be okay? Sometimes maybe just kind of feeling that area. This is not something to do before the 6-week clear. Check from your OB. If it's not healed, you're not doing it. But sometimes touching the area, even with the tissue paper, might you would have a little bit of a sign that, oh, maybe there's some tenderness, or no, that's not okay. If you're cleared for sexual activity after 6 weeks, but you're not sure about returning to sex yet, then assessing the tissues at that time yourself can be pretty helpful in easing some of those fears. So again, where to begin? Again, after it's fully healed and you've been cleared, then you're just starting with light touch and movement of the tissues at the vulvar level, so at the entrance level, so very superficial. And then you can progress with more pressure, stretching, and massage to the deeper tissues as well.
Yeah, and I think like you were saying, Ashley, that's super helpful just to understand, because so much changes there, right, after we give birth. And it's like, I think we're all very nervous. I'll speak for myself as well, that it's like, how is sex going to feel? What is going to hurt? Like, is it going to, something bad is going to happen. And so when you can sort of run through that or simulate it in your mind with your own hand, I think it can give a lot of reassurance for, going back to sex. And also you can ask your, OBGYN at the visit, like, hey, do you see any areas of concern, or, if there are specific areas too to be kind of paying attention to as well. So I think this is as much for like functional use as it is for like, reassurance for us that, how is it going to feel, or what might the sensations be that I'm going to experience.
And I think there was a question from the panelists at some point, that how do then we have that discussion with our partner about returning to sex, how to kind of start that. This might be a wonderful way. After you've kind of explored the tissues and the areas that are tender, or maybe there isn't tenderness, then that might be something that you can communicate to your partner. These were the areas that were tender. I'm a little bit nervous. Just letting them know and talking openly about it, maybe starting with your self-exploration first, would be a wonderful way to kind of broach that topic. And I know, Dr. Harper, you have some wonderful tips on how to have that conversation as well.
Yeah, for sure. I mean, I think that this is a great idea. I think that, if you can even, go and simulate something like this with your partner, say, hey, I know you might be a little bit concerned because our partners don't want to cause us pain. They want to have intimacy. They don't want to, increase our pain. And so you could, say, hey, I've looked around, I've touched around. Here's what I've noticed. Like, would you, should we like do that together? And maybe you do that in an academic way, or like an intellectual way, or maybe you do that in a sexual way. And you say, hey, tonight, I just want to, like, let's just use our hands. And so you can start to explore that way and kind of graduate sort of as you go, so that you can both feel really comfortable with it, because we have anxiety, and a lot of times our partners have anxiety too. So that could be a way to kind of ease into, all parties feeling more comfortable with the changes that have happened as a result of birth, for sure.
And we had a question around, are there times where perineal massage is contraindicated, like when the muscles are hyperactive, more than 6 weeks postpartum?
So I would, for certainly after 6 weeks postpartum, if it's before, it's definitely contraindicated. I would also say it's contraindicated if there is any kind of active herpes lesions or infections in the area. But with hyperactivity, I wouldn't necessarily say it's a contraindication. It might be a precaution that I would say, maybe if it's tender and hurting and it increases some of your symptoms, hold back, and maybe we can look at it, have either a physical therapist or your OB look at the tissues to see what could be going on. As in general, overactivity though isn't a contraindication most of the time, and oftentimes we do use perineal massage, vaginal dilator training, to help with that overactivity, to help kind of teach those muscles how to release and lengthen on their own.
Yeah. And I would say, the other ones that I could think of would be your doctor would not clear you. So like sometimes if you have an infection in your tear, which is very rare but can happen, if you have, this is something that's more common actually, like what we call granuloma tissue, like along your scar line. So that's where your tissue sort of heals exuberantly, a little too much so, and the tissue is just that's not how it should have healed. It's heals sort of in a way that's not helpful to you and can increase bleeding and pain. So your doctor would communicate those things with you at your 6-week postpartum visit if they were found. So if your doctor said, anatomically you're good, but, to Ashley's point, functionally, if there's something going on, then that's probably, something more worth exploring further, because you don't want to say, oh, I'm going to fix that with perineal massage. Right. You really kind of need somebody with eyes on you, creating a game plan for longer term success. And in most cases, we would recommend pelvic floor physical therapy for that. All right, so this one, go ahead. You want me to take it?
No, I was going to say, so when to call your OB, that's a perfect segue.
Yeah, perfect. So we were also kind of, when we were preparing for this, thinking through like, well, we've talked about kind of if everything goes right, but what about, what are some warning signs which require extra TLC? So we would expect, and the way that I always counsel my patients is that after birth, there is a lot of bleeding, and sometimes it's a little bit shocking, right? And it's very heavy, I would say, for the first maybe day, 2 days, and then it should start to really taper. So what happens is the uterus gets big, right? It has a whole baby inside. And then over time, the placenta comes off after the baby comes out, and that vascular bed where all the blood was supplied to the baby shrinks back down over time. But there's still some amount of bleeding associated with that. So that all that blood comes out as the uterus is shrinking back down to about the size of our fist, all the way from the size that it was right up to your diaphragm where your baby was. And so that whole process takes 6 to 8 weeks really. And so over time, what you'll notice is that the bleeding will go from like heavy and clots, and it will get less and less and less and less. So that heavy bleeding usually resolves within the first few days. Then it gets to be heavy like a period. Then it's sort of maybe like red and spotty to brown like the end of your period. And so you'll run the gamut of pads, and you cannot wear tampons during this time, right? Because we just talked about how we're caring for our vulva and vagina, and the tampons are not on the list. So we're wearing really big pads, sometimes even diapers at first. Then we go to like the heavy pads, then we go to the regular pads, then maybe the panty liners. But if the bleeding continues after 6 weeks, then that's something to, just bring to your provider's attention, because you really should have stopped bleeding. I've had a few patients that have gone longer than that, but in most cases it's because there's something else going on. So that could be that granuloma tissue that can sometimes form in the vagina. That could be something on the cervix. It could be something in the uterus. So there's several different things we have on our minds. It could be a hemorrhoid for all we know. But until you put eyes on it, you're not going to know. So that's something that needs to be brought up with your provider for sure. Subsequent to that too, if you're having new bleeding after sex, then that's something really important to let us know about. That could be really from any of the things I was just talking about. So those can cause just irregular bleeding, but they can also cause bleeding after sex as well, because the sex can kind of, irritate things in there. And then, we talked about this a little bit last time, but if you're having painful sex, right? And this is a question that we always get. It's like, what's it going to feel like? What should we do? Duh, duh, duh. And so here's the thing, like, it's going to be uncomfortable for the first maybe time or two, but it shouldn't really ever be truly painful. And the reasons for discomfort are, once again, if that perineum just kind of needs some attention, right? It needs some touch. It's not used to being touched. We've avoided it for a long time after birth and we're scared, right? So you can really ease yourself into that by touching and adding that incremental pressure like we were talking about. But that sometimes is uncomfortable, and that's okay. But if it's very painful and if it remains painful, that's not okay. The other cause for pain after sex or after birth is vaginal dryness, which is actually extremely common. And that's because many of us are lactating. And whenever we are lactating, our estrogen is low, like menopause. So a postpartum lactating vagina is a lot like a menopause vagina. And the two things that they have in common are lack of estrogen. And that has many effects. The tissue's thinner. We're at increased risk for urinary tract infections because the bacteria have changed. And also, we don't create the same natural lubrication that we might when we're not lactating. So that can be very easily remedied with an over-the-counter just lubricant. So, and there are so many. We have so many, I feel like, resources on lube. So please make that part of your, I need to just create like a pack of like postpartum sex things, and
yes,
lube would definitely
that's a great idea.
I know. Wait a minute. Yes, tampons are usually okay after 6 weeks, after your OB has cleared you or whomever is taking care of you. So I want to emphasize lube. And then for some patients, if that pain persists, when I hope they would come to me, and I've counseled them heavily about coming to see me, then, we can do a prescription in the vagina for a very short course. But really, there's no reason, there's plenty of reasons, but we never want you to justify having painful sex after birth, because there's lots that we as physicians can do, and as Dr. Rollins knows, that they as pelvic floor PTs can do. So we'll just really want to lay eyes on you if any of these things are happening.
I really like the idea of a postpartum sex basket,
Yes.
sex support basket. I think
I
that's
like that too.
what I'm doing for my next friend that has a baby. I don't know who the lucky girl is, but
That's right. You can sign up today.
Exactly.
Yeah, I think that's actually a really good idea. Okay,
Yeah.
we have to riff on that later.
So consulting a pelvic PT then, like we were mentioning, how do you know if you have pelvic floor dysfunction? Well, if you are experiencing any of these symptoms, it might be pelvic floor muscle dysfunction, and that includes pelvic heaviness or prolapse, like we touched on a bit, a bulge in the vaginal vault. Maybe you're leaking urine or potentially even poop. Maybe it's just kind of staining in the underwear, or you're having complete stool loss. Or you feel like you have to pee a lot, like frequently and urgently. You're rushing to the bathroom a lot more than what feels like you should be. Painful sex, of course, like we talked about. If it's not due to a medical reason, there could be tension in your pelvic floor muscles or possibly scar tissue that is limiting your ability to have pain-free sex. And then pelvic pain. So maybe even pain in the abdomen, the pubic bone, low back, tailbone, vulva or inner thigh area might all indicate that pelvic floor muscle dysfunction is present. Because of all of the things that you've just gone through, right, in pregnancy and delivery. But a lot of the causes include childbirth. It might include trauma as well, or chronic constipation, hormonal changes like in puberty or menopause or postpartum, stress, illness, especially like in the respiratory, if you have a lot of respiratory symptoms and lots of coughing, it's a lot of stress and strain on your pelvic floor, or maybe even overtraining. So like, especially in like high impact exercises or activities like high intensity interval training, running, or CrossFit, there's a lot of pounding and pressure and strain on the pelvic floor. Sometimes our body responds with tension and gripping and holding, and sometimes it can be over stretched and lengthened and not as supportive. And then injury, of course, to the surrounding joints. So of all, in our pelvic girdle, we have our pelvic floor muscles, but our pubic symphysis, our sacroiliac joint, our low back, our coccyx, all of those hips can all be affected. And then, of course, smoking with poor blood flow and circulation, and it can really affect our tissues and our muscle function and obesity.
Well, I know we had a bunch of questions in advance, so if there's anything that pop up, feel free to post in the chat, or I can go through some of these. I know we touched a little bit on the kind of return to sex, but I think there were a lot of questions around that. And you touched a little bit on this, Dr. Harper, but just sort of like we had a question of, should I try to have sex when it's painful, or how long or how normal, is it for me to feel pain with that? And so I think sort of that piece, and also then like how to get the sex drive back after the baby, sort of how do you all think about those pieces?
Yeah, so I think the way that we think about painful sex after birth is that number one, it shouldn't really be what I would consider painful. Like it's more in the discomfort zone. So like if we're on a scale of 1 to 10 and we get above like 8, like there's probably something that could be optimized there, either from my perspective or Dr. Rollins' perspective. Discomfort, I would say, is pretty normal for the first handful of times that you're going to be sexually active. I would mitigate that 100% of opportunities with lube, right? There's no reason anyone should ever have pain due to vaginal dryness, because we got a whole market full of lube, like ready, and can probably be at your house in 2 hours. You know what I'm saying? Like, let's just get some lube and just use lube postpartum. And then the only other real causes of pain are, if that cervix has kind of dropped, that can be pretty uncomfortable with penetrative sex. And then if there's some healing yet to be done, or some, optimization with that perineal tear. So, or really a vaginal tear as well. So I would say what's normal and expected is this discomfort, sort of this middle range, and maybe for a handful of times. You may notice that some positions are uncomfortable that used to not be uncomfortable, and that's really because of some of that descent that can happen of the cervix and of the uterus, especially postpartum. That should continue to get better and better, maybe another reason for pelvic floor PT. But painful, I would say if it's truly painful for you, and it sounds like this person's already tried more than 1 or 2 or 3 times, I would say I would definitely just make sure, number one, with my OB, that everything's good. And then if that person, if they hear you saying that you're having painful sex over and over, they should refer you to pelvic floor PT. If they don't, then maybe you should just see one because there's something going on there that needs to be helped for sure.
And I always kind of feel like pushing through with pain is only going to kind of reinforce that pain response and that pain cycle. So there's going to be fear and tension and kind of protecting that can occur if you are continuing to have intercourse with pain. That will only create more tension and pain, less natural lubrication, all of those things that might then just kind of make the whole picture of pain worse. Sometimes like it could be like warming up a tissue, like, get a little warm up in and the tissues feel better. But that would be more on the scale, like you were talking about, Dr. Harper, of discomfort. But really pain, something might be going on and that can totally be helped. And oftentimes pushing through with continued intercourse might just make that pain a bit worse. But still something that we can work with to try and help reduce the tension there.
Totally. And then the second part of that, I think, was about like regaining desire after birth. And that's like seriously one of the most common things ever because number one, you're not sleeping. Number two, you're usually pretty stressed. There's some partner sort of negotiation about new roles and identities in terms of how we function with this new person around. It's that drop in estrogen just really doesn't do much for us when it comes to our sex drive. So, I forget like a huge one, which is like how our relationship with our bodies, right? Like, yeah. I mean, in pregnancy, you're like have voluptuous and you've got this like belly that some people think is sexy. I felt like it was. And then afterwards you're like, oh, wow, where did like that filler go? Like it's just kind of sad. And so there's lots of things that does to your brain that mess with your, desire to have sex, and your identity, right, has changed. Like you're a mom. So many of us have trouble like resolving like this mom/sexual person, identity switch. So it's a very complex time. And I think that the number one sort of mantra is just a lot of patience with yourself in terms of what the expectations are, in terms of, how quickly you're going to, jump back into things. One of the best tools for that is to really tap into this idea of what we call responsive desire, which means, maybe before birth or in our younger years, even we had this spontaneous desire where we're like just sitting around thinking, oh, I think it's a great idea to have sex tonight. Like I could really use an orgasm. And then after birth, you're like, whatever, I could really use like a literally extra 10 minutes of sleep. Like, thank you, but no, thank you. Like I am going to prioritize, what keeps my brain healthy, but we forget that orgasms keep our brains healthy too. But, so one thing to do is to really take advantage of this idea of responsive desire, which is that when your body feels aroused, then many times you have the desire for sex. And so if your goal is to increase intimacy with your partner or to sort of find that sexual part of yourself, you can use tools like Erotica, which we have on the Rosy platform, an evidence-based tool to help improve desire. You could bring a sex toy in. You could bring in a vibrator and, use clitoral stimulation to really become aroused and then feel that desire for, sexual activity either with yourself or with your partner. So I think that it's more about saying to ourselves like, hey, this is yet another part of our identity that's sometimes, moves around because of birth. And really, when do we feel comfortable tapping back into that? When do we want to explore that as an idea for ourselves? And it's different for everybody. But when it's time for you, a lot of times that arousal, desire sort of pathway and knowledge can really help kind of kick you back into that positive relationship with sex and sexuality after birth.
Absolutely.
Yeah, we had a question, kind of a follow-up to what you all were just touching on too, was thinking about like that discomfort. Someone wants to know, how long is it normal for that discomfort to continue with sex if you're doing PT or if you're not doing PT? Like as I know the answer with most of these things, it depends, but would be curious, Ashley, what your take is on that.
Well, yeah, of course it depends. And I guess my understanding of the question is if you've determined that there's not a medical cause for the pain and you're in physical therapy now and they're having painful intercourse and they're wanting what a typical recovery looks like?
Yeah.
Okay. Yeah. So yes, it totally depends. It depends on what's causing it. Is it the scar tissue? Is it the muscle tension? Was there injury? Was there trauma? Is there an emotional component to what the pain is? Because a lot of that, there's layers of what could be contributing, and we work through peeling back what to do and then referring out. So if there is an emotional component, if there is trauma, then referring to a mental health care provider that has experience with sexual dysfunction and sexual pain, trauma and recovery can be so helpful and absolutely necessary in the rehabilitative process. The physical and the emotional, they go together. I'll see patients anywhere from 6 visits, or I've seen as few as 2, to 20 visits sometimes. It really just depends on the person and what their puzzle of pain is composed of. But it's always done with the patient and what their goals are in mind, and we work together to try and help iron out this plan of care that supports their goals.
Well, there was a follow-up which, for this specific person, their issue is mostly muscle tension, and they had a 2nd-degree tear that healed pretty well. So I was just curious if there's like a normal range of visits you would anticipate.
Yeah, there's no normal. I know that's such a frustrating answer, but everybody is so beautifully different, and it's a wonderful thing, but it does make it very hard to answer specifically, what it would look like for each individual.
Yeah.
But it's a lot of fun. We have a blast. We laugh in every session usually. So.
So yeah, if you're still having questions, you can do a consult. Hopefully you can get to the root of those issues. I think just one more question, which is, we see this a lot, which is kind of a question on how do I get my vagina like tight or back to where it was, which I know, I have a ton of thoughts about as well, but would love to hear your all's input for someone who's looking to do that.
Yeah, Dr. Harper, what's your take on a tight vagina?
So glad you asked. Let's get real here. I don't think that, men are asking after birth how they can get their penises bigger. I think it's just confusing. It's like the function of a vagina, there's lots of functions, right? But one of them is certainly birth. And for the most part, most people's, musculature does go back to a really natural, normal state. So there is, it can happen where, after birth, and especially multiple births or big babies, that the tissues of the vagina can stretch. And I would really counsel patients to be just cautious about this, right? Like if you're having some functional issue because of that, if your enjoyment of sex is somehow diminished because of that, if you're having trouble retaining a tampon, like these are some things we could definitely talk about, but there's no mandate or quest or, ideal tightness of a vagina. And as we know from just, that question we were just answering before this, in fact, sometimes that can be problematic, right? If the muscles are, overactive. And so I think just like Dr. Rollins was just saying, everybody's different, just like we acknowledge that, not all men's sexual organs are the same. Birth is a part of life. And, after birth, we can definitely learn about pelvic floor health. We can definitely practice pelvic floor health, just like we might want to, get back in touch with the muscles of our abdominals. We might also want to get back in touch with the muscles of our pelvic floor, but there's no necessary procedure or intervention, surgically, certainly, to tighten up the walls of the vagina, unless there's a problem for the patient herself. And that's something definitely to be discussed, on an individual basis. So that's my little 2 cents. What about you, Dr. Rollins?
Well, no, I think you answered it beautifully. I for sure, kind of having that goal, I always want to be cautious that tightness doesn't always necessarily mean better sex. In fact, sometimes it can mean more painful sex. So, certainly training or conditioning pelvic floor muscles that maybe are overly stretched and long and weak can help to improve the support of your pelvic floor. But the goal is never, to kind of have overactivity in those muscles to the point of pain. I did see this TikTok. I don't know if you guys saw it on alum powder baths, helping to tighten the vagina. And I of course want to, and I think there's some douches. Caution against that. Is not something that's actually really tightening the vagina. In fact, can dehydrate and make the mucosal tissue of the vagina vulnerable to tears, infections. And they use alum powder to help pickle fruits and vegetables. So certainly not something that you're wanting to put up to help tighten the vaginal tissues. It's not effective, and it might cause harm and infection and tearing. So. But yeah, I think you said it best. It's really kind of a further discussion in how it's presenting functionally and what those goals are for each individual person. So.
Great. Well, I think that is all the questions we have. Thanks everyone so much for your time. I guess, Lindsay, if people wanted to find more about Rosy, where would they go?
Yes, well, they should go directly to their app store and just search ROSY and then download Rosy. And we are all about supporting women, erasing sexual shame and isolation, increasing or really helping patients with women with whatever their sexual health goals are. If it's working through sexual trauma, we have a class on that. If it's, regaining sexuality after a cancer diagnosis, we have a class for that. We have a class on religion and sexuality. We have a library of erotica. We have a menopause class. We have a postpartum class, like we mentioned earlier, and a pregnancy one. So we really want to honor the fact that sexuality touches all parts of our lives as women and really provide women with the resources they need to sort of live that part of life to the fullest. So if that sounds of interest